Hey everybody, this is Jeffrey Munson with Dr. Bill. So Dr. William Clearfield at the Clearfield Medical Group in Reno, Nevada.
Doctor of Osteopathy.
Doctor of Osteopathy.
Right.
So,
and the Nevada representative to the AOA's House of Delegates. Not that I'm bragging.
there you go. There you go.
Sounds pretty
When
impressive.
did that happen?
My mother is very impressed.
When did that happen? Because you've only been in Reno 4 years? How many years have you been?
Well, you know what? I went to a meeting and I had to excuse myself. When I came back, I was the president.
Oh, there you go. That's how it works.
That's how that thing works.
So, all right. So, at the
Well, you've been away.
well, just because I had to go to the bathroom. Anyways, so it's hopping here at the Clearfield Medical
Yes.
Group.
While you were away,
Yes.
you know, we taken on a few new things because I think you told me that you were getting a little bored with some of our
Oh, gosh.
plain videos.
No.
So we had to learn some new things.
So well now, okay. So
Who
you do a lot of non-surgical. What is it called? Non-surgical
Aesthetics.
aesthetics.
Yes, we do.
So,
We do from the head to the toe.
Okay, like Botox, breast lifts,
Yeah,
facelifts.
yeah,
Well, not
well,
facelifts.
Well, we do non-surgical.
Non-surgical.
And that's what
facelifts.
we're going to talk about today.
Okay.
Because
Okay.
we picked up a very special type of facelift.
Okay.
It's called the Y lift.
It's not Y lift. It's
It's
the Y lift.
so you know what happens as we mature is that our face kind of falls, as you know. You know, Jeffrey,
Don't you
Jeffrey,
do
you
this.
used to be up like this. You
Yes.
used to be like this,
I
and
saw
now you've
pictures.
kind of fallen.
That's why we look better as we mature.
We do.
To a point.
To
And
a
then
point.
it's you're like, oh,
Okay.
turning around.
So if we look at your face,
Mhm.
and there's two main parts that kind of gravity takes over.
Okay.
There's the mid face here.
Mhm.
Now we're not talking about the wrinkles up here. That we're
Okay.
still going to, we'll just do a little bit of Botox and
Oh,
we'll
okay.
smooth that out. But the mid face here. So when these lines start to show,
Okay.
okay, if we take an upside down, an imaginary line, and we run it from your nose to here, it looks like a Y.
Oh, okay.
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 And what we're going to do is we're going to try and fill all this in and pull all of this back.
Oh.
Okay?
And you're not going to do surgery?
And we're not going to do surgery.
Oh, okay. Oh, that's awesome.
And then you can also do it in the neck and the chin the same way.
All right.
So
Can't just do
no. Well, you can, but
Does that do anything?
that?
Yeah. Does that? This used to be the exercise that back in the 70s or 60s.
It might, right? It'll probably give you a little black and blue mark if you hit yourself hard enough.
Okay.
Anyway,
Uh-huh.
so if we draw a Y from here
Mhm.
to here, and then another Y from here to here, what it leaves us with is the outline of a rectangle, and that's kind of the perfect shape.
Oh,
That's
okay.
what we want to find.
Okay.
So we're going to do two Ys, and what we'll get is the perfect shape. Now,
Oh, okay.
traditionally, when we use fillers and Botox, it's fairly superficial. We just want to fill in the little cheeks
Mhm.
here. But what we found is, first we started out just doing these little lines here, but the products that we use are all sort of hydrophilic, or water absorbs them. That's
Oh.
how they work,
Okay.
and they kind of get sucked away pretty quickly.
Oh, so
It
it
doesn't-
lasts.
Yeah, it doesn't last
Oh,
very
okay.
long.
Okay.
You know, it'll look pretty good for maybe a couple of weeks if we do well. But we
Oh.
want it to last longer. I mean, these things, quite frankly, are quite expensive.
Mm.
And, if they're gonna last a couple of weeks or not at all. And we don't want that kind of, chipmunk cheek look.
Oh,
also,
sure.
okay? So the Y lift actually uses a different type of instrument. It's called a micro cannula. I happen to have one right here. I don't know if we can see it. But it's not a needle. It's flat. It's a flat edge.
Now you're going to throw that away, right? I mean, not throw it away, but dispose of it.
I'm just going to demonstrate.
Not going to
it.
reuse it, are you? No.
What I'm showing you is, see, it's a flat edge. It's
Yes.
it's not a needle.
Okay.
Okay, it's a flat edge.
Okay.
So what we need to do is we need to get in under the skin, and we do
Mhm.
that by making very tiny, a little speck of Novocaine or lidocaine
Okay.
on each side, and we have an instrument that we use to measure the right spot.
My ex-wife just used to get under my skin in general. I shouldn't have to do
Yeah,
any
and
of
then
that
she's
stuff.
going to use a cannula. And we're actually going to go all the way to the bone.
Okay.
You're actually going to feel it.
Oh, well. Okay.
Okay. And then we're going to slide our camera. We're going to slide, I'm not going to touch it.
Right.
We're going to slide it under here. And so
Okay.
what happens is we're going to get between the muscle and the bone here. So it's not that we're going to have the product here, it's going to be deep, so it's going to fill all this in. Okay? And
right.
that way, we're going to get a really nice look.
Whoops, sorry, just shut my timer off. You guys, this is a more professional group here. So, all right, so
that'll give us a really nice look. So if you can see here, what happens is instead of the lines these lines filling in.
Yeah.
Can you see?
Oh yeah, you can't see these pictures, but I'll maybe we can post on the page. But this is a pretty big, drastic.
Yeah, this is a big, nice,
wow.
really nice chin.
Wow.
And we can do it in here. We can do the neck and the chin too.
So how long does this last?
This will last 2 to 3 years.
Oh,
it's actually there's the product itself. We always use Allergan products. We love these. These are as far as I'm concerned, the top of the line. And this one is only supposed to last 6 months to a year if you use it the way superficially. This is Voluma. This is last a little bit longer.
Okay.
And this is just for the mid cheek, and this is supposed to last up to 2 years. But when we do it deeply like this, it actually spreads out under the muscle, and this will last actually 2 to 3 years.
Oh wow!
It will last very much longer.
So do you think? Okay, so there's other things like the thread lift and different. And so do you think that the differences are that drastic opposed to?
Absolutely.
Really? So the Y lift.
The Y lift is
much
for, especially in here, we get a really nice look with a deep filler.
Okay.
And much better with much less product than we do just superficial.
Oh, okay. But
it's really a good look.
Okay, great. That's great. So, but it's still not a facelift. But looking at these results, looks pretty darn good. Really good. So
no anesthesia.
No.
Well,
really?
a little drop of Novocaine here.
Yeah.
And here, and it's not even as much as this.
How long does it take?
It takes probably about a half hour.
Really?
Yeah.
A half hour?
Yeah.
And you can just, is there a lot of bruising? What's the...
There's maybe, it depends, everybody's a little different.
Sure.
If you're on blood thinners, if you take aspirin, if you take ginkgo, vitamin E, fish oils, those are all blood thinners, you may get a little bit of bruising.
Oh, okay. And the bruising goes away.
In a good way.
I wouldn't do it.
I wouldn't do it before a performance.
Right, or
I wouldn't do it, right, or if you have a wedding coming up in the next week or so.
Yeah.
And you have a little bit of swelling, but not much.
Okay.
I mean, I usually say the downtime's a day.
And a facelift, gosh, a facelift is weeks.
Weeks and weeks.
Weeks.
So this is a great alternative.
Yeah.
We get a great result, and our patients are really happy with it.
Oh, awesome. That's great. Cool. So the Y lift.
The Y lift.
By Ronco. No.
The Popeil Pocket Fisherman.
Yeah, that's right. All right, that's cool. So the Y lift. So there's we'll have this information about this on the website.
We will.
And you can always Google and find out even more information.
Yep.
But Dr. Clearfield here, he does this procedure, and that's cool. That's cool. So everybody, call doctor, get an appointment, and if you like these videos, we appreciate you guys watching these. We have so many people commenting on them. It's nice. So, but share this, comment on it, and everybody just be a good human and have a wonderful, wonderful day.